Hi, welcome to EMDR with Alice. So today's topic is how to fit your EMDR session into a 50-minute session. I get this question asked quite a bit, especially from individuals who really have studied the model and have learned that Francine did 90-minute sessions, or they've talked to other clinicians who do 90-minute sessions or longer sessions. And they ask, well, how do you, it just feels like a rush session to try to do the reprocessing in 50 minutes. And so today I want to talk about how do you do that? How can you fit it into a 50-minute session? So the first thing that let's talk through is the importance of prepping your client for the reprocessing session specifically. So helping your client understand how that session is going to look and feel different to them is an important part of the prep. So walking the client through the structure, helping them understand it's going to look different than how the first couple sessions that we've met together have been. We're in these first couple sessions, we've spent a lot of time talking, we've spent a lot of time exploring things together, learning some new tools. In the reprocessing session, we'll be focusing the whole session on that target memory that you and I have agreed that we're going to be working on. And the way that we're going to focus on that is with the reprocessing phase of EMDR. And so what I'll tell clients is there's a lot less talking in that session. We'll spend the first 5 or 10 minutes kind of catching up on the week and making sure that we're agreed upon the goal for that session, which is to reprocess the target memory. And then after that 10 minutes, we're going to move in and activate that target memory by me asking a series of questions that will help bring that memory to the forefront, really to the present. And then for the most of the rest of the session, about 30 minutes of the session, it will look like me asking a question and then you following my fingers and then me pausing and saying, what are you noticing now? And what I mean by that is when I say, what are you noticing now? You'll just report what you're noticing in that moment, either in your thoughts, your emotions, your body, as I'm asking the question. And then once you tell me what you're noticing, I'm going to say, go with that. And then we're going to start following my fingers again or begin tapping. And that's the pace of the session is I will say, what are you noticing now? You're going to report what you're noticing in your present moment. And then I'm going to say, go with that. And then you're going to follow my fingers. And that's going to be the pace of the session. So there's very little talking that'll happen. Most of it will be you noticing what's happening in your body. And then we'll have a couple of those check-ins throughout the session. And so you prep the client for that. And so they know what to expect. They know that it's going to look different. It's going to feel different when we get to that session. And then you, the therapist, your job is then to keep the structure of the session. So again, the first 10 minutes when they come in is where you're just going to welcome them, check in, see if there's anything new that's happened in the past week that you need to know about. You establish this is what we're doing today. Our goal is to process this target memory. And then by that 10-minute mark, you are starting your phase 3 assessment and then moving right into your phase 4 reprocessing or desensitization phase. Once you've moved into that phase 4, you've got 30 minutes to really work in that phase 4 if you can get in there pretty quickly at the beginning of the session. And that's a good amount of time. A lot of clients can process a full target memory in 20 to 30 minutes. And so if you can start in right on time, then you should be able to, or the client should be able to process at least most of that memory, if not all of it. And then you'll want to keep an eye on your clock. And then at the 40-minute mark of your session, you want to start moving into phase 7, which is closure. So let's talk for a moment about closure. The purpose of phase 7 is to close down the networks. And so anytime you're going to be doing a reprocessing session, which means a session where you're doing phases 4, 5, and or 6, if you're using any of those phases in a session, you're going to always do a phase 7, which is to close down those networks. If you didn't finish phases 4, 5, or 6, then your closure might look a little different. You might have to do a little bit extra in terms of providing some resources to help the client change their state from an activated state to a grounded state before they leave the session. And so what that might look like is using some of those resources you developed in phase 2 in this phase 7. So we might bring up the calm, safe place, or the container if they created a container. Or if you've done attachment-based resourcing, you might help connect them to their attachment figures, either their internal attachment self or an external attachment figure, like a protective self, wisdom, or guidance figure. Once you've done that, so you don't have to do all of those, you just choose 1 or 2, depending on what the client needs. And then once they seem to have changed their state to a more grounded state, then I always try to end the session with what I call social engagement, or I don't call that. Bessel van der Kolk talks about it in his book, The Body Keeps the Score. But social engagement is where we are inviting the clients essentially back into their present life and engaging them in present moment. So that might look like me asking them, what are your plans for the rest of the day? Do you have anything you're doing this weekend? Or what's going on with your kids right now? Or something that I know is going to bring them back and get their brain thinking about their present life. I've even done things like, so, where are you going after this? If they say they're going to get something to eat, I'll say, what are you going to get? What do you think you're going to get? Where are you going to go? Would you like a suggestion? And we talk about that for a moment. All of that, again, is getting them back into getting their brain thinking about, where am I? What is today? What do I need to do today? What do I need to engage in today? And so really bringing that back online before they walk out the door is an important part. It sounds like I'm just kind of talking and maybe even joking with the client after the session, but it's actually really purposeful, is bringing that brain back online into present moment through social engagement. So thinking about the structure again of your 50-minute session, we welcome our client, we check in on the week, we identify the target memory we're going to work on, and then by that 10-minute mark, we have started phase 3 assessment and move right into phase 4. We do our phases 4, 5, and 6 as the client meets the goals of those phases, meaning they've got a set of 0 in phase 4 or a VOC of 7 in phase 5 and a clear body scan in phase 6. So we've moved through those phases over the next 30 minutes. And by that 40-minute mark, we are moving into phase 7 closure, where we do resource stabilization, inviting them back into the present moment with social engagement before we end the session then at the 50-minute mark. Hope this is helpful, and I look forward to bringing something else to you next time.